Hi friends, today we are discussing about Parkinson's disease. Parkinson's disease is a neurodegenerative disorder. The characteristic feature itself is the degeneration of neurons and results in dopamine deficiency. Dopamine, it's a neurotransmitter which helps to coordinate the motor functions, and this deficiency will lead to extrapyramidal motor defects and shows characteristic symptoms like rigidity, tremors, hypokinesia. Hypokinesia means slowness of movement. Causes. Main causes includes increasing age, oxidation of dopamine by MAO-B, and glutathione excess, glutathione excitotoxicity, drugs like reserpine, pyridoxine, neuroleptics. All these factors will contribute to the degeneration of nigrostriatal dopaminergic tract present in the brain, and this degeneration will resulting in dopaminergic versus cholinergic imbalance, that is dopamine deficiency and cholinergic excess. Therefore, the drugs mainly focuses to control this imbalance. Drugs for Parkinsonism includes dopaminergic agonist and cholinergic antagonist. The drugs which are acting on the dopaminergic systems for Parkinsonism includes dopamine precursor, levodopa, peripheral decarboxylase inhibitors, carbidopa, benseraside, dopaminergic agonist, bromocriptine, ropinirole, pramipexole, NMDA agonist, amantadine, MAO-B inhibitors, selegiline, resagiline. COMT inhibitors includes tolcapone, entacapone. Drugs which are acting on the cholinergic system to prevent this cholinergic excess includes central anticholinergics like procyclidine, piperidine, benzoxazole, and histamines like promethazine. Levodopa. Levodopa is the drug of choice for Parkinsonism, and it is a dopamine precursor. About 95% of levodopa is peripherally decarboxylated, and only 1 to 2% crosses the blood-brain barrier to produce dopamine. It also have a shorter T-half of 1 to 2 hours. Peripheral decarboxylase inhibitors, and these drugs given to prevent the peripheral decarboxylation of levodopa and to increase the T-half of levodopa. And thus more and more levodopa crosses the blood-brain barrier and it produces a sustained dopamine level. Examples: carbidopa, benseraside. So for maintaining the dopamine level, it's also always given as combination therapy like levodopa plus carbidopa combinations. Adverse effects. CNS adverse effects include psychosis, hallucinations and overexcitement, therefore contraindicated in psychiatric patients. Severe side effects includes tachycardia, adrenergic stimulations and cardiac arrhythmias, and caution should be given in cardiac patients. CTZ, it causes nausea, vomiting and alteration in taste sensation. Next is dopamine agonist. It includes bromocriptine, ropinirole and pramipexole. It is a dopamine agonist and it acts on dopamine receptors. Mainly it is a D2 agonist. It has a longer action of about 6 to 10 hours and it slows the rate of neurodegeneration, and it is given in only situations when the patient is not responding to levodopa. Ropinirole is also given for restless leg syndrome. ADR. Its adverse effects includes hallucinations, hypotension, nasal stuffness and vomiting. Caution should be given in patients who are taking antihypertensive as it causes hypotension. Next is MAO-B inhibitors, that is monoamine oxidase B inhibitors, which will prevent the peripheral decarboxylation of levodopa. It includes selegiline, 5 mg, 10 mg, resagiline, 1 mg OD. Selegiline. It is an irreversible MAO-B inhibitor. It has some neuroprotective effect and it is given as adjuvant therapy to levodopa. It prolongs the dopamine action. ADR, nausea, hallucinations, hypotension, etc. Though it is partially metabolized to amphetamine and produces some psychiatric reactions, and it is also contraindicated in convulsive disorder. Rasagiline. Rasagiline is 5 times more potent when compared to salicylic. It also have longer action and does not produce any excitatory side effects. Next is COMT inhibitors. COMT inhibitors also prevents the depletion of dopamine. It includes tolcapone and entacapone. Actually, this dopamine undergoes COMT oxidation, and this will result in dopamine depletion, and COMT inhibitors are prevent this dopamine depletion. It is mainly given as adjuvant therapy to levodopa to prevent its levodopa degeneration. It increases the T-half of levodopa, and ADR is similar to MAO-B inhibitors. Other side effects includes diarrhea, yellow-orange color urine, nausea, hallucinations. Next is NMDA antagonist, that is glutamate antagonist. It includes amantadine given at a dose of 100 mg BD. It helps in presynaptic synthesis and release of dopamine. It also has some mild anticholinergic effect.